afternoon, everyone. Thank you and welcome to everyone to our Research Connect series. I'm Maria Moret, a CDTRP patient partner, and I will be moderating today's webinar. I'd like to share a little bit about myself. I received a living liver transplant in 2021 at the University Health Network Ajmera Transplant program at Toronto General Hospital after suffering from a rare autoimmune liver disease called primary biliary cholangitis. And having gone through such a life-changing journey, I now join others as a patient advocate, bringing awareness and hope on issues of liver disease, organ donation, and transplantation. I'm also a registered nurse practicing in public health in Southern Ontario. Next, I'd like to acknowledge that the CDTRP is hosted by the University of Alberta, which is located on Treaty 6 territory, traditional gathering place for diverse Indigenous peoples, including the Cree, Blackfoot, Métis, Nakota, Sioux, Iroquois, Dene, Ojibwe, Saulteaux, Anishinaabe, Inuit, and many others whose histories, languages, and cultures continue to influence our vibrant community. I encourage you to write your land acknowledgement in the chat box. We would also like to acknowledge Takeda, AstraZeneca, and CIHR. Without their generous support, we could not host these sessions. But before we dive into the main content, I'd like to pass it over and welcome Erica for some general CDTRP updates. Erica?
Thank you, Maria. Today I only have one announcement, and it's a save the date for our annual scientific meeting. This year's ASM is less than 1 week away, and it will be in a hybrid format with the in-person component in Montreal, Quebec on December 5th and 7th. Registration is still open. Folks can register on our website. A link will be added to the chat box shortly. And for those that are registered, you can also access our program via that link. So thank you very much. Back to you.
Thank you, Erica. So before introducing our special guest, I have a few housekeeping notes. Today's session is recorded and will be posted on the CDTRP website and the YouTube channel during the presentation. Please keep your mics off. And if you have a question or comment, you can raise your hand with the raise hand button or type them in the comment section that we'll be viewing. With that, I am pleased to introduce our presenter, Kendra-Lee Dupuis. Kendra-Lee has completed her undergraduate degree at Brock University in 2018, obtaining a Bachelor of Science in Nursing. After completion of this program, she went forth to obtain her nursing license and worked as a registered nurse in various settings, including emergency departments and public and school health. More recently, beginning in September of this year, she returned to Brock University in the Faculty of Applied Health Science, where she aims to obtain a Master's of Arts degree with a specialization in nursing. Kendra-Lee, we're very excited to hear about your presentation today. Please go ahead when you're ready.
All right. Hi, everybody. As I was introduced, my name is Kendra-Lee. I want to thank everybody for coming today. And I also want to just kind of apologize. I am just getting over being a little bit sick, so I might be a little sniffly, congested. So just bear with me a little bit through that. So let's talk about kind of my background and how I got here, and then talk a little bit about what my proposed research idea is for my thesis, and ultimately to get your kind of opinions, thoughts about, what can be improved on, how this can be facilitated, and yeah. So as was generously explained, I completed my Bachelor of Science in 2018 at Brock University, worked as a nurse since that time, mostly in emergency departments. So in a few of them, from a rural hospital to, Southern Ontario to more, north of Toronto as well. And then more recently, I worked as a nurse at a college in their Student Wellness and Accessibility Center prior to coming back to Brock University to work towards my Master of Arts, specializing in nursing in the Faculty of Applied Health Sciences. So of course, this is a thesis program, so I'm going to be doing a research project as part of this program. So again, that's what I'm here to talk about a little bit today. I am completing courses in both qualitative and quantitative methodology, so kind of broaden my scope to be able to determine if I want to do either or in terms of the thesis project. I also work as a teaching assistant at Brock University and have for a few years now, since 2019. I help out with the nursing program here at Brock, and then I also have been working as a research assistant alongside Vanessa, just working on some scoping reviews in relation to organ donation and transplantation coordinators. So kind of my research background at this time. All right. So obviously just going to go through a brief overview leading into the topic idea. And the topic idea is, the perceptions of emergency nurses towards uncontrolled donation after circulatory determination of death. So of course, we all are very aware that the need for organ transplants in Canada remains very high. And the number of registered donors just doesn't meet those needs, resulting in hundreds of people dying waiting for those life-saving organs every year. And of course, we all know there are multiple donations pathways, such as your living and deceased donation, where majority of those last year came from deceased donations. And then we also have deceased donation being separated into, determination by neurological criteria or determination by circulatory criteria, with the former being used more often, but the latter also being divided into more controlled and uncontrolled options as well. And of course, with the increased needs in Canada and not being able to meet those, the direction towards the uncontrolled donation might be the pathway that we have to consider more often. And I know there have been a lot of studies kind of considering this pathway in Canada right now. So obviously we want to consider the perspectives of those who might be involved in that process. So people like the emergency department team or those involved in out-of-hospital arrests. So we already know the emergency department team provides support for the organ donation process right now, things such as identification of potential donors, referral to organ donation organizations, and just that underlying physiological support of donors to keep them stable for donation. So there have, of course, been a number of studies more recently around the world that are looking at, healthcare providers' perspectives in relation to organ donation after circulatory death, many of which do suggest, an overall acceptance of healthcare providers towards this donation after circulatory death. But I've also highlighted a lot of other key things that I think are important to consider in terms of our topic. So things such as education needs and ethical and moral concerns. Then of course, I'm very early on in my project, just started my schooling, just started my review and everything. But, among the literature, there was a lot of limitations or limited literature when it came to looking at the perspectives of healthcare providers and specifically for uncontrolled donation after circulatory determination of death. So I thought that could be an opportunity to explore this topic a little bit more. Now, among the studies that there was a few that were conducted specifically in Canada that I thought were important to touch on. So one of which was the one by the Canadian Council for Donation and Transplantation in 2006, which is on health professionals' awareness and attitudes of organ and tissue donation. And they specifically tried to focus on donation after circulatory death. So it was completed by, over 700 healthcare professionals, and the findings, highlighted a lot of things in relation to their acceptance of this pathway. It also talked about ethical concerns, lack of resources, need for guidelines and policies, education, and all of those types of things, which again, I just think are important to highlight for our specific topic. One of the things that, about this study though, is that the scenario that was provided was based on that controlled case. And it was also a survey designed to kind of lack those, firsthand perspectives there was the opportunity for some open-ended questions, but again, more of those, frontline experiences or perspectives, attitudes from those care providers. And then another study was by, I might say this wrong, Hunter Mann et al. And colleagues in 2019. Again, the attitudes of healthcare providers towards cardiac donation after circulatory determination of death. And it was a Canadian nationwide survey where over 300 healthcare professionals, including critical care nurses, physicians, and donation transplant specialists, highlighted their attitudes towards cardiac specific donation after circulatory determination of death, and ultimately described a kind of widespread support. So, these healthcare providers think that it is something that is feasible, but again, it was based on, those withdrawal of life-sustaining measures scenarios, and it's focused more on, specialists in organ donation, and those more emergency care providers weren't included. And then lastly was just a study conducted in Canada by Hancock and colleagues in 2017 about, education program for healthcare professionals on deceased donation. This one did include everyone, including ICU nurses and physicians and ER nurses and physicians. However, an overall finding from this was that low comfort with their competency levels. So again, just another thing to consider in terms of, the specific idea. And then again, this was focused on more of a survey design. So, proposed for my topic is to again explore the perceptions of emergency nurses towards uncontrolled organ donation after death determination by circulatory criteria, looking at some of those things that were mentioned, like attitudes, their feelings, those ethical implications, challenges and concerns, preparedness, training, education, resources, impacts for patient care, and impacts to workload. Taking that on more of like a qualitative design. So, sampling of registered nurses in Ontario, using, interviews, and then reviewing some of the documents of the current processes that are used right now. So I wanted to get just some more opinions from some of you who are, involved in this process all the time, as to what you think about kind of this research design, how we can improve on it.
Okay, so let me just add something because I
Yeah,
see a question from David. Hi, David. Good to see you here. So he asked, for the benefit of everyone in the call, would you be able to clearly define the key differences between controlled and uncontrolled DCD, and what are some of the key concerns or benefits of uncontrolled DCD? So I'll respond to that.
Sure.
So when we talk about controlled DCD is what Canada currently has implemented. So whenever there is no response for treatments in some patients in the ICU, and there is not a brain definition, or is not able, the physicians are not able to declare a neurologic criteria for death, then the family is informed about the poor prognosis of the patient, and there is an option for withdrawal of life-sustaining therapies. And at that point, the family is also informed about the potential of this person to become an organ donor. So that's what is called controlled DCD, because this person is already in the hospital environment, and it goes into the withdrawal of life-sustaining therapies in the ICU. There is a period of no touch until the death is declared, and then if the family has approved organ donation, then this person will go to become an organ donor in the operating room of the hospital. Whereas with uncontrolled DCD, it means that anyone that has, for example, a cardiac arrest, is on the street and has a cardiac arrest, and they try to provide all the support, and they start all the resuscitation measures, but this person is not responding, then the family could be contacted to inform about the prognosis that is imminent death, and that if they would be willing to donate the organs of their loved ones. And then this person would become a donor, and then they would proceed with a similar process of the controlled DCD with the no-touch period, and then sending the person to the operating room, or even considering other sources of external circulation just for the organs. So there's other different pathways that this individual could go through, depending on how the program is set up, in order for this individual to become an actual donor. This is not done in Canada yet. This is well established in Spain, for example, uncontrolled DCD. And there is some discussions in terms of how this could add to the system in Canada in terms of numbers of organ donors. Key concerns regarding this process is how overwhelming this could be for the people involved in the process. In terms of overload of paramedics, how prepared they have to be, or even the merge folks, and how they could be prepared to receive these people, the organ donor coordinators who are already burned out, and how this could add to their workload. And benefits probably would be the added number of organs to the system, and relieving some of the burdens of people that are in the waiting list. And the idea of this presentation is because Kendra-Lee is my master degree student, and this idea came together with Chelsea Lanos, who is a paramedic and has done some research with the paramedic side, but we don't have this done in the emerge side as well. And we wanted to bring this to you folks to discuss as a group and gather, thanks David, and gather your input in terms of how we can improve this study. So Kendra-Lee has put some questions together for you folks to help us understand how we could direct the study to be as comprehensive as is needed in order to move this potential implementation of such a program in Canada forward. So I'm going to stop talking, and I'm going to pass it back to Kendra-Lee. She's going to ask you folks some questions, and we would really appreciate if you could unmute or type in your responses or suggestions that you may have, because this is going to help her so much in directing her studies that are right at the beginning. Okay, so I'm going to stop talking. Thank you.
Thank you, Vanessa. Apologies for not explaining that more thoroughly. I was just trying to kind of be quick and brief, and I guess and it helps to make a bigger picture if everybody knows the differences there and why I kind of want to focus on this. But yeah, so I guess my first question then would be, what are your thoughts on this proposed topic of the project? Do you think this is feasible? A topic that should be considered? And again, feel free to unmute, put in the comment box as well.
Yeah, so Kendra-Lee has shared some of the research that has been done in Canada regarding this topic. But we noticed that we lack the perceptions of the merge nurses and physicians and all the healthcare professionals that are working in the emergency scenario. So we wonder if this topic of inquiring emergency nurses would be enough, or what are your thoughts if this would be comprehensive enough? And we have other questions to further explore this, but if you guys,
I can go through all the questions and we can just have a bigger discussion.
That's a good idea.
Or, yeah. Okay.
Yep.
So other question to consider, if you want to just go next. Yeah, do you think that the population should focus on registered nurses only, or do you think maybe other healthcare providers in the emergency departments, such as administrative staff, could also be considered as well? And then should we focus, again, Brocket's in the Niagara region, so should we focus on the Niagara region? Should we broaden and focus, more on all of a sudden Ontario, different areas within Ontario, or a bigger project that goes, all through Ontario. And then, yeah. Do you think that the proposed methods of, doing a qualitative approach of interviews and kind of looking at the document of the current processes is appropriate for this study? Or do you think maybe more of a mixed method design or, more just survey design would be more appropriate? And I think the last one is just saying, do you have any other thoughts about how, maybe the study design could be improved? Or maybe just overall thoughts as to what you think about it in general.
Thank you, Kendra-Lee. I'll jump in. There is one hand up, and we have a couple of questions in the chat. So
Perfect.
Just wanted to clarify, it seems like you want engagement throughout your presentation rather than questions at the end. Is that right?
No, I just said a general discussion is totally fine. Yeah.
Great. Okay. So let's go to, we had a hand up.
I just can't
I think
see
it was Amina.
Amina, would you like to come on, and then we can go in the chat and see some other questions?
Yes, absolutely. Thank you very much, Kendra-Lee, so far for that great presentation. I'm sorry if my audio is not great. I'm just in the car.
You're good.
So
You're good.
I just have a couple of questions regarding to the population for your study. So you mentioned you are planning to go for a specific setting. And I wonder if there is any statistics that you have used to back up that. So for example, is this hospital with high levels of DCD donation, and therefore you wanted to know the perceptions within that setting specifically? Or are you planning to further define that to try to choose settings that are going to be more likely to be hosting uncontrolled DCD in the future? Because considering that's a master's proposal, I don't think you should be focusing in more than one hospital. I think one is good to start. I just wonder how that choice of setting is going to be made. And I don't have suggestions. I'm just asking.
You say you have suggestions?
No, I don't have suggestions, but I think it would be good if you had a look at what are the levels of DCD donation in the hospitals within the Niagara region, because that may be giving to you a better perspective where to start that study. Because sometimes if it is a setting, even though it is controlled DCD, if the healthcare professionals there are not very familiar, I don't think they're going to have a lot of contributions to give to you if they don't have a lot of donations per year. So maybe looking at the statistics of those settings could be helpful, that you can find somewhere that you can find more meaningful information, if that makes sense.
Absolutely, yeah. And it might have to be where I look at that and they might not be a good population, and I might have to consider, more larger hospitals in like the GTA that deal with this more often. I think it's something I have to look into further.
Maybe even like within GTA, especially now we are doing a lot of, I'm not sure if it's going to be a survey or qualitative study, but even if it is a qualitative study, you can get a hospital within GTA that has like larger numbers of DCD donation per year, and you can conduct the interviews online, just as an idea again. Thank you very much.
Vanessa, would you like to respond to that?
Yeah, thanks, Amina. That's great, great insight. And I wonder, now that you talked about the numbers, I wonder if we could also take a look at the numbers of cardiac arrest and death through cardiac arrest and emerge in the region as well. That may be some data that we can look at to understand what would be the hospitals in the region that could have that type of program potentially implemented, and maybe engage Trillion Gift of Life Network as well. And in the next step, once we have this project a bit more mature, for their input as well on this, especially because their coordinators will be involved in this. And I see Katie had a question in the chat that it goes a long way with this discussion. If we were planning to look at multiple provinces, we wish we had the time. And that's the reason we're presenting here, because in the network, if someone has an interest in this topic that would like to collaborate in this project, we could potentially make this a national study with multiple people leading different parts of the country. So that could be a possibility, and that's why we wanted to present here as well. And how are we planning to connect with the nurses? So maybe you can share that, because you have the connections, right, Kendra-Lee, here in Niagara?
Yeah, so originally I was just planning on focusing on Niagara, it's just where Brock is. It's where my experience is, and I've, experienced, cardiac arrests and such very often, which is also what led me to kind of this topic and this area of interest. So of course, could, reach out to the hospital coordinators, research team to try and reach out to nurses in the emergencies all across Niagara to get their kind of perspectives.
Yeah, but if we find that this study should be expanded to a province-wide, for example, we could potentially contact either the Canadian Nurses, the CNO, or the Canadian Nurse Association as well, and ask for their support and sharing with their network of nurses and people that are registered under Ontario. And the same could be done in other provinces. We just need to find the right context for that. And then David mentioned it would be helpful for the nurses to have a practical experience with DCD to be able to inform their opinions and moving to uncontrolled DCD. Right. I agree with that, David, for sure. I wonder if we are to introduce this in hospitals where they don't act, because emerge nurses might not have this exposure to uncontrolled DCD, because this usually happens in the ICU settings, right? So I wonder if the project could include some potential education component in terms of the types of donation prior to interviews, if we go to interviews, or maybe a focus group approach where you could potentially have that background info first and then you follow through the focus group afterwards. Do folks think that would be a good way of going? What's your opinion?
If anyone has some suggestions, you can come on camera and unmute yourself, or feel free to populate the chat.
I don't have an opinion of either, since I don't have a nursing opinion, but I think maybe you can elaborate on the pros and cons of each. Maybe that could be, and somebody can chime in on maybe something they hear there that they can relate to.
Say that again, Erica, the final part. Elaborate on what, sorry?
Like maybe if you're saying the pros and cons, maybe one of, I don't know exactly, but one of the cons that you say, someone's like, actually, that's a pro. Did you think about it this way? Maybe that could be a better way to get a discussion out of the individuals involved in this call.
Yeah, so let's think. The pro of doing interviews is that we wouldn't have to work on people's schedule to find the best date to do the focus group. If we are to do this online, we would save even more, because we don't have to go and have a place for the focus group, for example. Whereas for the focus group portion, we would potentially get more out of the discussion by presenting the actual information regarding uncontrolled DCD versus DCD, etc., that they may not have, right? And we had other, yes, go ahead, David.
Yeah, thanks, and nice to see everybody. And I just, so Kendra-Lee and Vanessa, I think this is a fantastic, let me just preface this by saying, I think it's a fantastic area of research. I know in the, the 10 plus years that I've been working in organ donation, we've talked about it in Canada, moving towards uncontrolled DCD, but, there's a barrier, and there's, it's a culture change. And I think that's probably one of the pieces that I think would be really interesting to get at is how do you change this culture? Because from my understanding, the way that they talk about it in Spain is that to do uncontrolled DCD, you have to start doing unnecessary CPR on the dying patient, right? So this CPR it's not going to save the patient. You know this patient's already going to die. So you're only doing CPR to save the organs. And this culture change is a different way of approaching treatment to care. So, the way that North America has always approached medicine is to say, like, don't do any harm to the patient, don't do anything unnecessary, don't do any unnecessary harm to the patient, don't give them treatment that's not going to benefit them. So moving to uncontrolled DCD is you're saying, well, I'm going to do something to the patient that has no benefit to them whatsoever, but this is going to benefit another patient who's waiting for an organ. And so in Spain, they talk about this, that that they start, so when they're in the ambulance, they start intubating and doing CPR on the patient in the ambulance, not to save that patient, but to save the organs. And then they inform the family once they get to the hospital, oh, we've done CPR, we've put them on, we've intubated them, we've put them on life support, but they're going to die, but this is to preserve them to be an organ donor. Do you then give consent? So it's a totally different approach than what we do here in Canada, which is if the patient's not going to die, well, we stop CPR once we know that the patient's not going to benefit from CPR. And so, to me, the kind of questions you would want to get at in the emergency room nurses is this culture change, is this sort of like shift in, can you see, because we talk about these like harms in the system. And if you look at the work that Sam Shemy and Samara did in their donor identification work, so for them, what they sort of looked at is what are the harms every time we miss a donor. So every time we fail to identify a donor, we're doing harms on other patients in the system that are not getting an organ. And what kind of accountability mechanisms do we need to say we failed to identify a donor, therefore we're doing harm to another patient? It's kind of the same way in which you have to then change the culture change in the emergency room of saying, okay, well, you're not doing this to save this patient, right? Whereas the entire focus of an emergency room nurse is to take care of that patient. But then you have to sort of say, well, no, now there's also an obligation to other patients that are not right in front of you, but you have other patients in the system that would benefit from this. So I think for me, the culture change, I think, is really important if we're ever going to get to an uncontrolled DCD in hospitals. The other question I think that's important too, and Vanessa, you were talking about this in terms of education. I think if you're going to look at regions, so like just doing a quick check, it looks like emergency rooms, like the number of donors that come from emergency rooms right now is like less than 2% of all donors come from the emergency room. So this is going to be, and if we're only talking about 750 organ donors per year, well, less than 2% is like, 15 organ donors that come from emergency rooms. So the incidence of this happening per year is incredibly rare if you think of how many emergency departments there are in Canada. So the chance that any nurse that you interview has actually seen an organ donor is going to be pretty rare. And so I think you would want to think about, okay, so what's people's level of awareness, understanding of the organ donation process? Most people don't even understand. Even if you ask people, how many organ donors do we have in Canada per year? Most people think it's in the like tens of thousands of donors per year, or that 50% of all people who die end up being an organ donor. Like they don't even realize it's like less than 1% of all deaths end up as organ donors. So I think just even understanding what's their level of awareness of organ donation, what's their level of understanding of their role in organ donation, and how they would see a donor go through the emergency department. Like those kind of things to me, I think would actually help us inform if we were to put this into practice. How would we actually change the system? How would we change the culture? How would we change their you have to introduce a whole identification and referral, like what are the triggers to say, well, this person qualifies as a potential organ donor in the emergency room setting. Like this, it sort of unlocks a whole new scope of work. We have really good clinical triggers in the ICU setting. We use the GIVE criteria, which is the grave, I can't remember what all the letters stand for, but it's similar. You would have to develop a whole similar set of clinical triggers in the emergency room to then say, okay, well, all of these patients have to go through, like, if you see this patient that meets all these criteria, then you would, start the uncontrolled DCD process. So just even getting them to think about, okay, so how does that work in your current workflow? How do you assess patients? How do you think about end of life in your patients? I don't even know how many nurses in the emergency room right now, or physicians, even call Trillium. Like, that would be a first step, is to find out, just in Ontario, how many referrals do you get from emergency room departments? Is it like as many as we think it should be, or is it pretty low? Are they referring every death? Are they referring some deaths? So anyways, those would be some of the things that I think could inform the work you're doing. But I think it's incredibly important. Okay, I'll stop.
Amazing. Thank you. That was great. Thank you very much.
Yes, thank
Are we there?
you. Yes, David, thank you very much for that sort of broader perspective as you were talking, and being someone that received a living donor organ, liver. It is difficult conversation, and there isn't a lot of awareness. Initially when I was looking to have a transplant, I was on the deceased liver list, and really worried about that I wouldn't receive an organ in 2 to 5 years, because I wasn't that emergency sort of sick in hospital. So Kendra-Lee, I think about, are the emergency nurses the target? They're the target group here for your research, but the system sort of starts well before that, in that awareness and education of organ donation, and families having that discussion, or individuals making that decision about what they want for their body should a situation occur where there's a potential to donate. So the nurses, look after that emergency situation, but it's not perhaps top of mind. And I think that's in the focus group of what you'd want to look at, is that even a thought that comes across, because as David said, it's, the situation happens, the individual is in the paramedic, the ambulance, and that's when the process needs to start to happen, as the individual is in a life-threatening situation, to even be able to save those organs to give to somebody. So how do we broadly work, or Kendra, thinking about the other organizations that play a part in organ donation, and how to sort of start that conversation broadly with associations and hospital sort of departments that become involved in that.
Yeah, I'm gonna speak to that. I think that for us to be able to do that, we're gonna have to count on the current networks that exist in terms of the organ donation organizations, right? They have the nurses already working as organ donor coordinators in these hospitals. So they have the contacts of the hospitals, and if something is to be implemented, we'll definitely have their approval or implementation process put in place as well. So I'm just gonna put an invisible mode here because I have some delivery folks here. I lost my train of thought. So what I was going to say is regarding organ donation organizations being involved in this and being the ones helping us to connect with those hospitals. However, because we're very mindful of the time that she has for the master's program. I know she has intentions to go into a PhD later on, but for this project, we may need to be smaller. But again, if anyone in the network and is interested in this topic and would like to further discuss and how to collaborate and make this project bigger, please let us know, because definitely this would be the next step in terms of a donation system in Canada. And I agree with you, Maria, that the perspectives of the families and the people that will be involved is important. And that I honestly don't exactly know how to get, right? I think public awareness is something very unique and even difficult in terms of how to connect with the media, how to connect with the public, and how to get the correct people to join such project, even as partners or as participants, study participants, for us to understand their unbiased opinions about this topic, right? Because I know you folks are in the network and you're pro-donation, but we need everyone's opinion, even those that do not believe in this, and we need to understand all perspectives and how this potential implementation in the future might impact the other things that are going well in the system, right? Because sometimes we try to be innovative, we try to implement something, and it goes south. As it happened in Brazil years and years ago when they wanted to implement presumed consent without public consultation. And it was terrible. The rates of donation dropped drastically. And that's definitely not something that we want to do with this project. We really want to explore a potential avenue. So if any of you have an idea of how we could include the public opinion as well in this project, please let me know.
Kendra, maybe back to you for a little bit to see if there are other questions or probing sort of situations that would be helpful for the research project.
I don't think I had any other questions. They were all kind of posted in the chat there. I think, the comments that have been made are very helpful in considering, the things that should be talked about. So like the culture and, just considering, just emergency nurses' experience with this at all, and do they even refer, and should we focus on more of like just with just organ donation in general, I think is important and something that we'll have to kind of talk about beyond this.
Mm-hmm.
Yeah.
Well, I think, nurses do have a plethora of experience in dealing with families that surround the patient in that situation of an emergency. And I think it's a good place to start, honestly, and gather those perceptions and see if we can glean some information from emergency nurses that might help inform sort of some of the other aspects of your research.
Yeah, absolutely. Because our emergency nurses, as was mentioned, just not referring as much as, maybe they could be, and then maybe that's a whole other area that could be focused on.
Yeah. And maybe there's a misperception that they can, right? I think as nurses, we want to save the patient in the moment. And it is an emergency situation, right? We're not necessarily thinking about beyond that. So it may be building a little bit of that awareness.
Absolutely.
That it can be possible in some medical situations that are emergency, but sort of stabilization, so that donation can happen. And with recognizing that there are other organizations and likely people on this call that their roles are to promote that awareness of donation, and not just in that emergency situation.
Mm-hmm.
David.
So just an interesting point, and this was because I didn't know what the numbers were, but I was kind of trying to think of like, okay, so if we talk about, okay, so what's the experience that emergency nurses would have with organ donation, if we say, less than 2% of all organ donors come from the emergency room. I was just also interested in the concept of like how much experience do emergency nurses have with death in general? Like how many people actually die in the emergency room? And when I do a quick Google search on this, but so it says we've got about 15 million unscheduled emergency department visits in Canada per year. So 15 million people come to the emergency room. Of those, how many people die? It's 18,000, right? So like it's a lot of people, but at the same time, compared to the number of visits you see, that's an extremely rare event in the emergency room department. So I think even just the concept of dealing with death in the emergency room may be something like in the broader context, like uncontrolled DCD is getting very specific. But I may even pull back and say, okay, well, just how comfortable are you dealing with death in the emergency room? And because most of the patients that are emergency and end up being organ donors end up in the ICU. So they leave the emergency room and are stabilized in the ICU in the emergency. I don't know how much contact the emergency nurse still has following them through that process. So anyways, just some things to think about in terms of putting it into perspective of like how familiar they are with even death in the first place. I think, could be an interesting place to start in the conversation.
Yeah, for sure. Because maybe I know a lot about it, but probably from more of my research experience with Vanessa than actually being an ER nurse. So maybe, like you said, kind of take that step back and just focus on, what are their even perceptions with, death or organ donation in general.
Yeah, I just wonder if that could be duplicating some of the studies that have been conducted in the past, not only in Canada but worldwide. That's my only concern, because investigating like perceptions and experiences in terms of organ donation in general has been widely researched, but uncontrolled DCD not so much in the ER setting. I wonder if it would be worthy to include the other healthcare professionals that will also be part of a potential uncontrolled DCD case, and maybe have a focus group instead of interviews, so we can gather the different perspectives and understanding of death and organ donation, etc. So we could potentially merge David's idea on understanding the concept of death and how they deal with it, and also understanding the donation side and their role in that process and their potential role if we were to implement this in Canada, right? This is great, guys.
Any other comments regarding Vanessa's sort of merging of the ideas? I think it is an interesting concept, as it's not just the emergency nurse that sort of shows up. It's the healthcare team, and how in the moment that team is again sort of concerned about the health of that individual and stabilizing them. And at what point does the conversation about organ donation happen? And so maybe that's in that focus group question of, when is the transition from we're not able to save this person to, okay, let's talk about, maybe it's in the protocol, a change in the culture and the shift of what other questions need to be asked or considered, and donation needs to maybe be part of that protocol questioning, and setting that system in place of, okay, so what happens now? How do we get a hold of the donation coordinator? Trillium, yeah. Because it's all a matter of timing at that point, right? To try and save as many organs as possible from that individual that is likely not going to survive due to the cardiac situation. Any other thoughts on that? Linda.
Okay, hi. Great presentation. And just thinking about the comments that David made in describing how DCD happens in Spain, and wondering it would increase the scope of the project substantially, but thinking about the EMS paramedic component of this pathway. There's not a lot of training about donation in the EMS curriculum, is our understanding. And if they're going to be involved as a key element of the uncontrolled DCD pathway, might be helpful to bring that group in. And if we're looking at culture change, they will be part of the culture change. So I know it's beyond the scope of nursing, but maybe there's an opportunity for a multidisciplinary approach.
I was typing in a chat, but I can respond now. That's great, Linda, for sure. And we have Chelsea Leno. She's a paramedic. She's part of the RDOT group as well, and she's going to be part of Kendra-Lee's supervisory committee. Her thesis focused on the paramedic site and how to implement that. So we're trying to investigate now on the ER side and then merge the information to inform a potential development of such program in Canada. So you're definitely right. We need the perceptions of both sides, the folks that are responding to the emergencies in the homes of the people or wherever that terrible situation happens, and also was receiving this individual in the hospital to go through the rest of the process and how to connect with the coordinators. So it's definitely a very complex implementation for a program, because it involves moving pieces and unpredictability that is even higher than the regular organ donation process. So it is discussion for many years, but we need to start somewhere. And we have seen some projects started, but the discussion does not move beyond that. And what we're trying to do, and what I always try to do with my research projects, is to actually have that knowledge translation piece and informing changes into practice. So I truly appreciate all the input you guys are providing here today, because it's going to be extremely helpful on shaping this project in a way that is inclusive of all the perspectives that we need to include. So we truly appreciate it. Thank you very much.
Thank you, Vanessa and Kendra-Lee. I think this is a very complicated, complex, multifactorial, multi-organizational sort of discussion. And as you said, you have to start somewhere. Discussions are just discussions and talk and dialogue. And I think understanding at the emergency room level and who plays a part in coming together and making those decisions and protocol informing is great. So with that, I'd like to wrap up and thank Kendra-Lee for that wonderful presentation, and wishing you all the best on that research that you're about to embark on and have thought about. And it sounds like you've got lots of support from Vanessa and a number of folks on the call. And just to thank everybody for their questions and conversation today. Kendra-Lee, on behalf of the CDTRP, thank you again for presenting. If anyone has additional questions or comments or any suggestions for topics and speakers in the future, contact Erica Croft at EKCROFT at cdtrp.ca. I would I'd like to also mention that we're going to be sending out a short survey evaluation that should take you no longer than 3 minutes. And with that, I'd like to thank everyone for coming to this Research Connect today and to enjoy the rest of your day. Thank you very much.